Sloan.
Sloan, your first name?
Ben.
Ben.
Call me Ben.
I'm Joe. This is Mrs. Sloan. What is your first
Bromley
name?
Sloan.
Bromley Sloan. What is your first name?
Gina.
Gina. I'm Joe. Nice to meet you today. Thank you for coming in today. And let's see, I'd like to talk to you a little bit before we get started, just to find out some things about you. I'd like to know a little bit to see why it is that you're here today. Could you tell me that?
Her?
He's here because of you?
He says I mumble. I don't mumble. Everybody else hears me okay.
Does she mumble?
I think she does.
This
I
is,
think she does.
This is a common complaint, but are you really the reason why he's here today?
Well, I had to make him come. He canceled 2 other appointments.
Why have you canceled 2 other appointments?
I just really, I don't think that I have a problem.
Okay. All right, so without a problem of hearing, why do you think she wants you to come?
That's a good question. That's a good question.
All right, let's just ask a few questions. If I could just get a little bit of the history, something about you, maybe
Sure.
it'll help me, because we're going to take a hearing test. That test is free. All of what we do is free here at Beltone, other than the purchase of the hearing aids. But we do the testing. We want to educate you. We're going to show you a nice little program to see if there really is a hearing loss. If we could determine that there was a hearing loss, how would you feel about that?
I'd be interested to see what, if I've got a problem, I'd be interested to see what it is and where it is. But I think it's going to show that she just doesn't speak to me clearly anymore.
Okay. There could be another whole other problem here, I can't deal with that. Let's see. You don't think you've had a problem at all. How long would you say he's had difficulty in hearing?
3 or 4 years.
Is it just hearing anything or everything, or is it just the understanding part of it?
I think he's having trouble hearing altogether, but it comes down to a whole lot of what, and then then he gets frustrated.
I hear.
Yeah, but you don't understand what I'm saying.
Because you mumble.
I don't mumble.
Okay, now I hear her fine. She doesn't mumble. I can hear her pretty well. And for the most part, believe me now, you're here in a place where there's a hearing professional. This is what I hear a lot. We hear this hundreds and hundreds of times, thousands of times. And it is common for a person who doesn't have an understanding that they have a hearing loss. It is common for them to be the only one that doesn't know. Other people can tell if we have a hearing loss. Other people know if we say, "What was that?" or we don't respond when we call the name or something to that effect. So what I would like you to do is, let's assume that for just a few minutes that your wife isn't lying, that she didn't bring you here just because she doesn't like you. Or let's assume that your wife really doesn't mumble, because there might be a lot of other people she talks with that don't think she mumbles.
Okay.
I'm number one. Everything that she has said, I've heard, and she hasn't really been raising her voice. So let's just go through this a little bit and see if you can't determine something other than, there's another reason for this.
Okay.
It could be possible that your hearing has degraded a little bit. How old are you?
I'll be 62 this year.
62? What would you say if I told you that hearing really starts to go downhill 30 years old?
Really?
Yeah. Let's talk about some of your history. Like, what was you're not retired, right?
No.
You're still working. What is your occupation?
I actually go in and I work in a factory setting a lot. I go in and perform maintenance on machinery.
How long have you been doing this around machinery?
About 22 years.
22 years around machinery. Do you wear hearing protection?
Yeah, I'm supposed to, but not all the time.
You're supposed to, like, government like OSHA says that
Exactly.
probably you should have it.
Exactly.
Did you know that OSHA says that we're supposed to wear hearing protection when we run our lawnmowers, power tools, things like that too?
No.
Pretty much nobody does. But we are finding that this is a significant factor in over time, a period of time, you've been doing this 22 years, over time this can affect our hearing so that we have a little bit of trouble hearing or understanding more specifically.
I was in the Air Force before that, so I was,
Around planes.
yeah, I was
Did
on
you
the
fly?
flight line. I was on the flight line.
All right. Can you see how that could possibly have a problem with hearing?
Yeah, I get, yeah, I can.
Okay. Have you ever had any experience with people who have had a hearing aid? Ever seen people? Have you had anyone in the family that's had a hearing aid?
My mother did.
Did you know that one of the factors of hearing loss is heredity?
No.
A lot of people, it runs in the family. So if their mom or dad has had a problem or another close family member like that, sometimes they also have a problem. So that could be something else. What about childhood diseases? Ever have mumps or measles? Or how about a high fever? Can you ever remember having a high fever as a child?
Not really, just the normal
Everyday
things, yeah.
Okay. Any problems on the telephone? Can you hear everything on the telephone when somebody's calling, or do some people sound a little bit off? Or can you understand every single thing said?
Yeah, I get these calls from India, Pakistan, something like that. I can't understand those accents, but other than that, I think I do pretty well on the phone.
How does he do
Uses
on
the
the
speaker
phone?
function a lot.
You use the speaker function?
Well, I do that, yeah. Sometimes.
Do you know why you use the speaker function?
Good one.
It's easier for me to hear.
Which ear do you normally listen to when you're answering the phone?
I use my left ear.
So, if you use your left ear normally on the phone, right, and now you have to use the speaker phone, there's a possibility you're not hearing the best out of that left ear, and you want to use the speaker phone because you need to hear a little bit better. And the speaker phone does help, right?
It does.
Yeah. When you use a speaker phone, you see both ears come into play instead of one, and it helps you to hear better. But that will also help you see that there might be something a little bit amiss.
Okay.
Okay.
All right.
All right. You mentioned about work and working in noisy places. That's a real big factor in people having a hearing loss. And if you work there for 1 week or 2 weeks, that's not a big deal. But if you're in a place where it's noisy for over 20 years, this constant bombardment on your hearing center in your ear and the connection between your brain and the ear, the problem with that is it just deteriorates over time. And as we get older, other body parts start to fail. We have lots of problems, right? Ears are one of them. We have found that as people get older, their hearing decreases, sometimes very significantly. And where it manifests itself first, we think other people are mumbling. And if other people are mumbling, and really they're speaking correctly, well, then the problem isn't with the person who's speaking.
It's not just your voice. I mean, it's, some of the women in the offices at work, I can't.
Women in the office.
Did I have to, the reception, some of the receptionists.
You knew there were women in the office, right? Yeah. But women's voices, they're in a range where normally you would stop.
I mean, I can hear the voice, but I don't always understand what they're saying. Sometimes they turn away,
Do you hear some people better than others?
I don't have a problem hearing you at all.
Okay. And there's a good reason for that. You see that door right there?
Yes.
Everyone who comes through that door has a hearing problem. And I speak twice as loud as I normally do for 2 reasons. One, I need you to understand what I'm saying, and I need you to follow my instructions. And my voice is usually in a range where people don't have the initial hearing problem.
Your voice is great. I mean, I can.
Okay, so what we're going to
Why
do...
can't you talk like him?
Hormones.
What we're going to do is we're going to do some testing. And that testing is going to see if you hear the range of my voice clearer or other ranges clearer. And it's also going to show if her range, or voices, women's voices, children's voices, softer sound, that's going to also show us whether or not you have a problem in that area. So you may have a problem in one of the areas and not the other. You may have a problem right across the board. But we're going to try and determine that today. And that's why I'm asking you a lot of these different questions.
Okay.
Because that's going to help me to determine how to help you. And if we can help you. Now, today, before you leave, we will know whether or not you have a hearing loss. How does that sit with you?
Well, that's why I'm here.
You said you were here because of...
Well, you know.
Okay.
But if there's a problem, I won't. My ears don't hurt.
No.
I'm not deaf. You know, I've been around loud noises, but like I said, they never hurt my ears.
And that's fine. That's what we're going to try and see what the deal is with today. What we're going to do some testing.
Okay.
Okay? We're going to determine whether or not there is a loss. If there is a loss, what we're going to do is try on a set of demonstrator hearing aids for you. Those are going to show whether or not it can cover this hearing loss that you might have. Now, if you do have a hearing loss, would you acknowledge it? If we do the testing and the testing shows that you have a loss, would you acknowledge it?
I'd have to.
Yes, but now think about this. That's going to prove her right.
You better hope you've got a loss.
She's right most of the time.
Well, okay, and I thank you for doing that with me, because this is really important. What's really important is to try and get together on this and find out exactly what's going on. And, you know, some of the things that are irritating aren't just to you. The person who has a hearing loss, if you think some people mumble, if you're having a problem with some women's voices at the office, there are some other instances where there's not, it's frustrating. It's a pain in the butt. But you know something? You're living with somebody who doesn't have a hearing loss, and it's just as frustrating for her. It's also a pain for her. And really, when you think about it, you're a team. A hearing loss does this to couples. It doesn't do this. People get frustrated. People don't want to speak. Is there ever a time where you don't really want to say something to your husband, to Ben, because you know he's either not going to hear or it's going to become an issue, and so you'd rather just not say it at all?
Oh, yeah. If we're out, I try not to say too much to him because he misunderstands me, then he starts yelling, then other people hear. It's embarrassing.
So, can you
It's
see
embarrassing.
how that can
Did you hear that?
can be? I'm not going to repeat what she said.
Thank you.
But can you see how that could cause a little bit of trouble?
Yeah, yeah.
So it's irritating, it's frustrating. These things do happen, and this is a common complaint, and we see a lot of people with this. All right? So what I want to ask you, though, would you like to get some relief from that? Would you like to get some help from that? Would you like to see her a little happier because, hey, maybe you can hear better?
Yes.
I don't want
Yes.
to. I don't want to wear a hearing aid. I mean, I'm too young to wear a hearing aid.
It's not going to get better. It's only going to get worse.
If you're too young to have a hearing aid, how do you feel we would be able to help you?
I'm not sure that. Well, kind of guessing now that I do have a problem, but, I mean, I don't know what it is or anything like that. But, yeah, you know, to be honest with you, it's frustrating for me. Yeah, I don't want to just have to keep saying, what, huh? You know, we were in a restaurant, last week, and the waitress asked me if I wanted something, and I told her no, that I wanted something else, and I completely misunderstood what she was saying. You know, fries or rice or something like that. You know.
And that's good that you can recognize that. If help was available for that, wouldn't you want to take advantage of it?
I would.
All
Yeah,
right.
I'd look at it.
Well, what do you say we start the testing, see whether or not we can help? And I feel personally that I can. And so I think you're going to have a good experience here today, and you're going to see something remarkable. All right? Let's start doing the testing.
Now, sir, what if he doesn't have a loss? Are you going to tell him that too?
If he doesn't have a loss, he really doesn't have to be here, does he? But from what we've learned here and what we've seen, it seems like he probably does. But the tests will prove whether or not he does.
Okay.